sexual assault in the context of family violence is the focus of work undertaken by many centres against sexual assault located across the state. And Charmaine Farrell is from the CASA at the Austin Hospital, and she's going to explain how CASAs can collaborate to provide support in emergency departments. Welcome, Charmaine.
Before I begin, I too would like to acknowledge the traditional owners of the land that we're meeting on today, the Wurundjeri people, and the members of the Kulin Nations, and pay my respects to any elders present and any community members present and elders past. Sorry, I feel a little bit nervous suddenly. I guess following on from Natasha's presentation, I'm going to talk about community resources, sexual assault services, and I think that's probably the really critical thing for health services to work more in partnership with community services. So, the right-hand one. Sorry.
No, you're right, just around that way.
And
click there.
Okay, there we go. That's me. Good. I manage the Centre Against Sexual Assault at Austin Health, which covers the northern metro region, but I'm here representing CASA Forum today. And CASA Forum is really the peak body for the Centres Against Sexual Assault in Victoria. There are 14 centres against sexual assault and the Victorian Sexual Assault Crisis Line. I think 8 of the CASAs are departments of public hospitals and 6 are independent NGOs, and the Sexual Assault Crisis Line is a department of the Women's. The Centres Against Sexual Assault are government-funded agencies. I don't know if you all know these things, but I'll just go through them. That provide free and confidential support services to people who've experienced sexual assault, whether recent or in the past, doesn't matter how long ago. And the services are available for anyone who's experienced assault, whether they're male, female, gender not specified, adult, children. CASAs are not funded to work with offenders, so it's not our sort of area of expertise. So I'm really going to talk to you really today about the response in the emergency department, essentially. Although there could be a disclosure of sexual assault to any health worker in any department of the hospital, we're focusing on the emergency department today. In Victoria, following a recent assault, a person is entitled to an immediate response, and for CASAs, a recent assault is considered to be within the last 2 weeks. So for police, it's 72 hours. The response, the crisis response, usually happens in a hospital emergency department. There are some other models, but for the purposes of today, we'll focus on that. So a person might present on their own, or might come in with police or in an ambulance, or there might be a disclosure to ED staff in the context of perhaps any other presentation. Could be a family violence context, but you may not be aware of that. All the Centres Against Sexual Assault, all 14, work closely with the emergency departments of their local hospitals. So regardless of whether they're an independent NGO or a hospital department, they'll still have close working relationships with all the hospitals in the region. So in the emergency department crisis response to a recent assault, the protocols, the processes include that medical concerns always take precedence. and that the victim would be triaged and medically cleared. That may seem obvious, but quite often and quite recently, health staff might be concerned that they should not do anything with a victim of sexual assault because of tampering with the evidence or whatever. But our focus is always that medical concerns take precedence. So the CASA counsellor advocate will assess the patient's non-medical needs. Police might be called, or they might already be in attendance, and the role of police is to investigate a possible crime. And a forensic medical officer or a forensic nurse educator from the Victorian Institute of Forensic Medicine may or may not attend. And the crisis response usually takes between 2 and 6 hours on average. Once the patient has been sort of medically cleared, the CASA worker will then coordinate the next stages of the response, so providing information and options to the person, calling police if they're not there and if that's what the person wants, and organising a support person if necessary, or not if the person doesn't want that. And liaising with the local family violence team or the social work department as per the wishes of the person. So the CASA counsellor advocate is there to support the victim, and from the point of view of hospital health workers, that's really important to know, because you don't have to sort of know or understand the processes and the steps. You can refer to the CASA worker, who'll work collaboratively with emergency department staff, advocate for the patient to receive what she needs, referral to mental health workers or a particular registrar or whatever. In most cases, or in many cases, there will be a need for the patient to be triaged before anything else can be done. So the CASA worker will always ensure that the patient is sort of brought to the attention of the nurse in charge or the triage nurse if that hasn't happened, which possibly it depends on the particular hospital. There'll be different processes. But quite often a request might be made for a private room. And I think that's come up a couple of times today. And CASA workers are aware that that's not always possible, but if a short stay room could be found or a family room, the privacy is pretty critical for a victim of a recent assault. So there may be a request for that. In some emergency departments, there will be a CASA room or suite of rooms that's dedicated for the CASA to provide this response, but in most hospitals there won't be that. Each hospital should have its own set of protocols. If you're a small rural hospital and you don't have a set of protocols, that's something that you need to get organised, and you can work with your own social work team and also with the regional CASA on getting that organised, whatever you might need in terms of policies or how to refer to your local CASA. So so the role of the CASA crisis care worker basically is to provide information, support, advocacy, support the patient to make her or his own informed decisions, and advocate for the person to get the supports she needs. The CASA worker will identify any concerns, so like safety issues at home, any ongoing family violence concerns, or safety and well-being of any children who may or may not be with the person. and will take action to ensure the safety of any affected children. So that would be through referral to the local family violence team or to the statewide Safe Steps team. And in some areas, so in the Mallee and in northeast Victoria, the CASA and the Family Violence Services are one and the same organisation. But it is different in every area, so it's really important that you find out where your local CASA is and develop a relationship with your local CASA. And as Natasha said, with your family violence police liaison worker, officer, and also with the local regional integration coordinator for family violence services. So if you've got those three key support services that you can work with to develop local pathways and referral processes, you should be on track, I guess, with responding if someone discloses or is brought in. Was that a cough for me? Time's up. Okay. I'm pretty much done. I'm just going to zip through to the end. So that's the 24-hour number for the Victorian Sexual Assault Crisis Line, 1800 806 292, 24-hour number. And if you're not sure, if someone presents and you have a sexual assault disclosure or you think there is a sexual assault issue, ring SACL and you'll speak with a counsellor advocate who is very experienced and who can advise you about the processes and where to go. Thank you.